Vital signs are an important part of our patient assessment, and typically the only point at which a patient gets vital signs done is when they come into a healthcare setting. There's a few exceptions to that, such as Holter monitoring, which is done on specific patients where we're concerned about a heart arrhythmia. But for the most part, the only time that we really can measure the heart rate, the respiratory rate, the oxygen saturation is when they come into a healthcare setting. But these vital signs can be subtle signs that a patient is starting to deteriorate, or early warning signs of that as well, prior to a patient getting a more overt symptom. And so by having vital signs monitoring at home, we can hopefully discover that a patient is starting to have problems earlier, and then trigger a response to that so that we don't have to wait for them to get sick enough to come in. We can make a change, allowing them to stay in school, stay at work. The other way that we can use it is on patients who, where we're expecting them to have problems with their lungs, for example, with cystic fibrosis, and we can monitor cough and things like that now. But by being able to measure respiratory rate and oxygen saturation on a regular basis, we can again identify early infections or other problems that a patient may be having, and again intervene earlier, hopefully preventing them from having to come in or going into an emergency department, and shifting them to the clinic visit where they can see their specialist who knows them, or to their primary care provider. And in addition, we can hopefully keep them in school and in